Good day. Let's get started. When you hear health literacy, what do you think of? Is it merely the ability to read and write? What about comprehension? Health literacy has many definitions and is on a relatively fluid scale, depending on the source. Here in this hospital, we need to focus on health literacy as the ability of the person to understand and meet the demands of their health, including the execution of basic health skills. This includes asking questions, understanding their diagnosis, knowledge of what medication they're taking and how to take it appropriately, as well as any other important instructions related to their diagnosis, like reducing sugar intake for diabetics or physical therapy exercises after joint replacement. As you may or may not be aware, survey results from our patients indicate that they leave here confused about their health information. This is not to say we are not doing our job as healthcare professionals, but a reflection that we aren't communicating effectively. By not taking into account a patient's health literacy and communicating at their level, we are leaving them out of their own health care. While patient education materials are wonderful tools, even these leave out many patients because they are written at a 10th grade level. This is alarming if most material presented to patients is recommended to be at an 8th grade level, and those with poor health literacy read below a 5th grade level. So what can we do as healthcare professionals and providers to help our patients? To help our patients help themselves, giving them those tools is the most important way we can help. The first area of concern is with medication, educating them on why they are taking medication and the proper way to take it. The other area that will benefit the patients is by encouraging them to ask questions. Majority of the patients discharged from this hospital will be responsible for taking at least one medication daily. For someone who has never taken a daily medication or already takes medications, this can be overwhelming. In fact, the more medications a patient is on, the less likely they are to take their medication correctly. Medication taken incorrectly does more harm than good for the patient. Taking too little medication renders the treatment ineffective, while taking too much of the medication can potentially be fatal. With the focus on healthcare shifting to patient autonomy, patients are responsible for their own health, which includes managing their medications. Being able to effectively communicate and reinforce in writing the patient's medication schedule before they are discharged will empower the patient to take control of their health care. At the end of a visit, patients remember less than half of what was discussed with a physician. Additionally, they may be confused as to how to proceed, as many of our own patients have stated. Patients with lower health literacy are less inclined to ask questions to clarify the discussion. Those with low literacy overall tend to feel shame and embarrassment because of it. Patients with low health literacy see their relationship with their health decisions as consenting or dissenting to a medical plan, not as a shared plan with their physician or other healthcare worker. It is for these reasons that patients need to be encouraged to take an active role in their health by asking questions and clarifying what they don't understand. There are a number of national campaigns, policies, and programs that exist to improve and erase barriers to good health literacy. I will only be discussing a few today that pertain to our main goals of getting patients to ask questions and take their medication correctly. One important national health program focused on improving health literacy, especially when it comes to patients taking their medication correctly, is Healthy People 2020. Healthy People 2020 seeks to remove barriers to health literacy, especially the social determinants of health. One of the goals of Healthy People 2020 is to improve medical product safety and reduce overdoses of medications. Another group advocating for reform of medication labeling is USP. USP is focused on creating uniformity and transparency regarding what each medication is, what it is taken for within confidentiality limits, and how to take it. Currently, USP does not have regulatory power in the standards it has developed. However, states are able to adopt the recommended standards developed for patient-centered medication labels, which many have for a number of medications. There are two major national campaigns focused on getting patients to ask questions. The first campaign, Ask Me 3, encourages patients to ask and have answered 3 basic questions at every medical encounter. They are, what is my main problem? What do I need to do? And why is it important for me to do this? The goal of this campaign is to get patients active and interactive in their care. The other national health program focused on patients asking questions is Questions Are the Answer by the Agency for Healthcare Research and Quality. They provide resources for patients about why they should ask questions and examples of important questions to ask. This program emphasizes the role of the patient in the healthcare team and the importance of asking questions about their own health. Now that we've gone over the basics, the who and the why, we need to look at the how. How to communicate better with the patient so that they are able to ask more questions about their health and understand how to take their medications correctly. Having patients understand how to take their medication correctly requires a diverse set of communication principles. One very important method to make sure patients understand how to take their medication correctly is to use the teach-back method, also known as the interactive communication loop. The teach-back technique in its most basic form has the patient explain, as if they were telling a loved one, what they learned at their appointment. This way you are able to gauge what the patient understands by what they relay or fail to relay back to you. This method can be applied across the board with your patient encounters, but here we'll be specifically tailoring it to taking medication. Pay special attention to what your patient does and does not say. Offering praise and reinforcement for key points your patient remembered is helpful, all while making sure to go over again the important concepts they may have missed. Make sure to tailor information to the patient's lifestyle and interests. For instance, if medication needs to be taken on an empty stomach and your patient is often forgetful, suggest putting medication on their nightstand or next to their toothbrush, so they remember to take it before bed or first thing in the morning. You can use the teach-back technique until the patient understands the correct way to take their medication. Another concept to ensure patients understand how to take their medication correctly is by using plain language when you speak. Plain language appeals to people of all ages, genders, educational backgrounds, and cultural backgrounds. Plain language consists of a number of concepts. You should be sure to use common one- or two-syllable words as well as define necessary words and phrases, especially ones relating to their diagnosis. Plain language uses consistent phrasing. For instance, if you refer to their medication as a pill, you should not substitute other terms like tablet, soft gel, capsule, etc. throughout the rest of the conversation. Also, be sure to avoid using concept, category, or judgment words, as these are subjective terms. Patients, more than likely, do not have the same idea of moderate or rare as you do. Finally, make sure you are speaking with a friendly, conversational tone and be clear and specific with what you say. Switching gears now, getting patients comfortable with asking more questions requires a different set of techniques. The first thing to keep in mind is that it is difficult for patients to ask questions about their own health, so when they say they don't have any questions, that does not mean they understood what you told them. Actually, asking questions is something we have to learn. It is not something we do inherently. Culture can play a role. It may be considered rude to question an authority figure. Patients may also feel stupid or inadequate if they ask about a question. Now, how do we overcome this? As we talked about, the Ask Me 3 program and the Questions Are the Answer program have resources available to help patients feel comfortable with asking questions. There are also simple techniques you can use during the visit to help patients ask questions. The first is to simply ask them to think of 1 or 2 questions to ask by the end of the appointment. You can add to this that patients asking you questions help you to do your job better. This takes the internal burden from the patient if they think it bothers you. Another technique to remove the internal burden from a patient thinking they are bothering you or asking stupid questions is to offer reassurance that this is not the case. Another simple technique you can use is, instead of asking a direct question like, "Do you have any questions?" is to ask an open-ended question like, "What questions do you have for me?" Another technique to get patients to ask questions is to have a list of commonly asked questions related to the patient's condition. Asking the patient if this is a question they might have also could open up dialogue and more questions. If the patient insists they do not have any questions, you can yourself ask questions. Asking why a patient is there and gathering information that way will not only gauge the understanding of the patient, but give an idea of what areas they need additional information on. Finally, encouraging patients to write down their questions will help them remember the questions when presented more information at their visit. In any case, When patients are still unclear and do not demonstrate understanding, even after applying these techniques, thinking about why is the next step. In these cases, you may have to deal with learning disabilities, very low and limited health literacy, hearing loss, cultural differences, or a number of other issues. In these cases, you will need to look further into the cause for the discrepancies and address them at the source. These instances will require additional techniques, which we will discuss in subsequent programs. If you have specific patient issues you would like to discuss after the program, I will be available to answer your questions. Now is the time to put the information into practice in a group exercise. For this exercise, you will form pairs. Everyone here likely has differing levels of experience in healthcare, especially depending on your role. We are going for simplicity with this exercise by focusing on how to get patients to understand how to correctly take their medication and feeling comfortable with asking questions. You will each take turns as healthcare worker and patient. In this exercise, we are focusing on getting patients to ask questions and to take medication appropriately. We are using the example of a new hypertension diagnosis with accompanying medication. The practitioner will focus on communicating information about what medications the patient takes, why, and how to correctly take the medications. Additionally, they should be able to elicit questions from the patient regarding their medication or diagnosis. As the patient, you should be able to understand what medications you take, why you take them, and how to correctly take them as described by your doctor. You should also feel comfortable asking the doctor 2 questions about the medications or your diagnosis. After you try each role, we will reconvene as a group to discuss methods that were effective, areas that were difficult or confusing, and any questions or suggestions you might have for one another. As we have been discussing, there are a number of techniques to employ to help patients feel comfortable with asking questions and with taking their medication correctly. The teach-back method is effective for gauging a patient's understanding regarding how to take their medication correctly. Having patients feel comfortable asking you questions requires a number of techniques. Asking open-ended questions of the patient, requiring the patient to think of questions by the end of the encounter, and phrasing in questions and statements so that the patient feels empowered and not embarrassed are some of the techniques to help elicit questions from patients. Practicing techniques like this now will help us feel more comfortable using these techniques with our patients. In just a minute, when we get started, I will be passing out the prompts, assessments, and pens. We will have 5 minutes in each role. After our 10 minutes of pair work, we will reconvene as a full group to discuss together what methods worked, what didn't work, and any other key takeaways. So to go over the scenario, as the practitioner, your patient, Mr. John Doe or Ms. Jane Doe, has had high blood pressure on their last 2 visits to your office, as well as when they used the blood pressure machine at the pharmacy. Today you will be discussing their new diagnosis of high blood pressure, as well as their new medication lisinopril that you recommend they take. They currently take simvastatin for their high cholesterol. By the end of the counseling, you should have discussed their new medication, how to take their medication, and elicit 2 questions from the patient. From the patient, you have been having elevated blood pressure on your last 2 doctor visits, as well as when you used the blood pressure machine at the pharmacy. At your last visit, the doctor discussed the dangers of high blood pressure and told you that if your blood pressure was still elevated at this visit, that you two would discuss medication to help you lower your blood pressure. You are currently only taking simvastatin for high cholesterol. By the end of the meeting with your practitioner, you should know what medications you take, why you take them, and how to take them. You should also ask questions about unclear instructions. Before we get started, I just want to give you a visual of the forms you will be filling out in your role play exercise, one for each of the patient and the practitioner. Lastly, these are questions to keep in mind that we will discuss as a group after you complete each role and role play exercise. If there are no further questions, we will get started at this time. Thank you.